As a market leader, we feel very proud for our green initiative. We have taken significant steps to reduce plastic burden by 160 tons per annum with our economic solution, Abhirav and Abhirav PF. As a company, we take our corporate social responsibility quite seriously. Either it's adoption of government schools where IL is providing infrastructure and basic facilities, including help in midday meal programs. With our association with NDDB, our gift milk program, over 1,600 school-going children are benefited regularly. IL has donated oxygen generation plants to TIMS in Hyderabad. These are a few of our CSR activities among many. For more information about Human Biological Institute and IIL, you can log on to www.indumin.com. Puberty to menopause, P2M, is yet another social responsibility by Human Biological Institute. This is a platform, and specifically with our show, We Talk Do You, we talk everything about women's health. Today, with this show, we have yet another very important topic. Look, as a parent to a very beautiful child, you have settled into the role of parenthood nicely. You're thankful for what you have, but there's a sense of conflict. Many desire to have another baby, but they have not been able to get pregnant again. It's a strange space. And this loneliness of secondary infertility is hard. It's not a unique struggle. Many like you revel in the joy of parenthood, parenting a little one, yet longing for another. So today we have a very special guest with us. Let's know more about secondary infertility from her. It's an honor to welcome Dr. Varhsa Shrivastava. She is a senior consultant gynecologist and IVF specialist from Indra IVF, Gaya Center, Bihar. Very good evening, Dr. Varhsa, and most welcome to We Talk To You.
Very good evening to Ms. Payal. This is a great honor for me to be on this platform. And I assure you that after this discussion, many of our patients, many of our people who are suffering from this problem, definitely they will get to know something which will help them to overcome this problem.
Absolutely, Dr. Varhsa. Even we are very much looking forward to our discussion today. So before we begin with our questions to Dr. Varhsa, I would like to request everyone watching us today, if you feel this particular topic would be of interest to anyone, any of your friends, relatives, and family, please feel free to share this link with them so they can ask their questions. And if you have any questions, please put it in the comment section. You can also message to us. By end of this session, we would ask all the questions to Dr. Varhsa, and she would take up all the questions one by one. Thank you so much. So Dr. Varhsa, let's start our discussion today. So the first question that we have for you is, what is secondary infertility? Since it's very sad that everybody take up primary infertility as a major point of concern, but when it comes to secondary infertility, it's not looked like the first case. So what do you think? What people should know about it, and why is it so common these days? Why should we talk about it?
Yeah, I think Ms. Payal, you have already briefed about what is secondary infertility, right? So secondary infertility is by definition, it is a problem where one couple having one previous pregnancy, irrespective of his outcome, but she or they are unable to become pregnant again, right? The previous issue will be anything. It may be a healthy child delivery, it may be a preterm birth, it could be an ectopic pregnancy, it could be any kind of abortion like missed abortion or blighted ovum, anything. But second time they are unable to conceive. So this is defined as a secondary infertility, means having one pregnancy, but after that they are able to have a second pregnancy. Yeah, here I would like to press on one point that the previous pregnancy or first pregnancy should be of without any fertility treatment, right? Means it should be a conscious spontaneous conception, and after that the couple is unable to get pregnant again.
Right. So Dr. Varhsa, what do you think?
Yes. It is as common as primary infertility nowadays, right? So most of the time the cause is depends on couple itself. Most of the time we plan for a first baby and then we focus on our career. So we postpone it till we are just in a state where we cannot achieve it spontaneously, right? So the reason behind this, the partners are living in a different city because of their career goals. There may be a first child, and because of lack of family support for carrying the baby, they want to postpone it. And the thus most important cause is that they think that if we can have pregnancy once, why not have it in second time? Okay, so this is because of unawareness of various factors which can affect their fertility potential. So they just in the ignorance phase, they postpone their second pregnancy and ultimately land up with the problem which is known as secondary infertility.
Okay, thank you so much. That was quite simple. I'm sure many would have understood that. So, Dr. Varsha, now coming to the causes, one particular cause that you mentioned is because of potential aging and that there's a huge gap. Apart from that, what are the other primary causes for secondary infertility, both in men and women?
Yes, we can differentiate the causes into categories. One is the male factor and second is the female factor. In male factor, abnormal semen parameter is most common cause of secondary infertility. And semen analysis, we look for the sperm count, the motility of the sperm, and the morphology, that is the structure of the sperm. If any of these parameters get worsened at the age or by any other problem, it may lead to secondary infertility. The causes behind this normal semen parameter could be any, like medical causes or secondary surgical causes. In medical causes, like any kind of nerve injury, any kind of thyroid disease or hyperemia or reduced testosterone level. And in surgical causes, if any male get operated for any kind of genital organ injury or varicose or any other disease which affect the genital organ, it may hamper the sperm production and lead to abnormal semen parameters, right? So this is all about the male factor. And now coming to the female factor, this is a broad spectrum category for female factor. A lot of causes which belongs and which lead to secondary infertility. So in simple way, we divide it in three factors. Number one is the lifestyle changes. Number two is the medical causes, and number three is the surgical causes. In lifestyle modifications, like because of overuse of other chemical toxic things. Number two is the aging. Number three is again. Number four is the stress, which are because of their professional life or their personal life, right? And we talk about medical reasons. So thyroid diseases, hormonal imbalance, most common is the PCOD. Hyperprolactinemia means increase in the prolactin level, and because of aging, there is decline in the AMH level, which is the indicator for her ovarian reserve. And when we talk about the surgical causes, we divide it again in tubal factor, in ovarian factor, in uterine factor, in pelvic factor. So when we talk about tubal factor, if there is a development of any pelvic inflammatory disease or genital tuberculosis, it may lead to the tubal blockage. Any of the both the two can be blocked, or either it become blocked or it become non-functional. Means the purpose of tube is fertilization. So there is difficulty in that space, that part of the tube, which lead to fertilization. When we talk about ovary, so with the gradual increase in the age of the female, there is decline in the number of eggs, number of quality of eggs, and that may lead to ovulation, irregular cycles, irregular periods, and menopause. When we talk about uterine factor, there will be some mucus polyp, some mucus fibroid. It means the growth inside the uterine cavity where the embryo has to grow. There may be associated diseases like fibroid ells, which may be at the cornual side of the uterus from where the tube is attached, so it can lead to tubal blockage. There could be an endometriosis, there could be an pelvic inflammatory disease, and there could be any kind of infection which may affect the uterine lining, that is the endometrium. We talk about the pelvic inflammatory disease. The most common is the endometriosis. Endometriosis is a very, very well-known problem nowadays, because as the ambitions of the female is increasing, the stress is increasing, there is more chances of endometriosis to occur in the female. This may lead to chocolate cyst formation in the ovary. It may lead to distortion of the ovarian anatomy in the female's body, which ultimately lead to secondary infertility. So these all are the various causes which can lead to secondary infertility, and most of the time it is just because of ignorance just because not identified the problem at the right time.
Okay, all right. That's a good point for us to note. Are there, as you have mentioned, the most important, I mean, the most common problem is not finding at the right time. So, what do you like? What do you? Are there any specific signs that a couple should look out for, and which will help them to understand that they might be getting into the trap of secondary infertility? So, are there any possible signs for it?
Yes, definitely. If a woman who is around 30 years of age and a woman who is around 35 years of age. So for both the women, the criteria is different. If a woman is 30 years of age and they are trying for second baby in 1 year without any treatment but not getting pregnant, then she is supposed to find out the cause. The cause may be if she is suffering from irregular periods. The cause may be if she is difficulty in having intercourse. The cause maybe it is urea or dyspareunia. So it means if there is something difficult, something problem in their genital system. Another thing is that when the female is more than 35 years of age, so means the age cross the healthy egg quality level, right? Because after 35, there is a sudden decline in the egg quality and the egg number. So if for a couple where female is of 35 years age or more, then the time period for trying is only 6 months. After 6 months, you should seek the treatment. You should seek the cause of your infertility. And as we talk about the sign of secondary infertility, this is simple. If you are trying for 6 months to 1 year and not getting pregnant, and along with this, you have difficult menstruation or irregular menstruation or any kind of weakness related to body, means something wrong is happening to your body, which can lead to secondary infertility. Apart from that, some physical problems also responsible for the secondary infertility, like if your female is getting gaining weight, if there is the development of more facial hairs or belly shape is more, or if the female is getting irritated or loss of concentration or if they headache. So it may be because of your hormonal imbalance. So PCOD may be the reason, your high prolactin level may be the reason. So this is all you have to be aware that apart from being conceived second time, if you are suffering from all these reasons, all these problems, then there is something abnormal in your body. It may be a biochemical factor, it may be a medical problem.
Okay, thank you so much, Dr. Varhsa. I think that brings us to our, a most important question. That is, when and what should a couple do if they suspect secondary infertility, if they are trying for another baby and they're unable to? What do you suggest those couple to go for?
Yeah, initially there are two steps. No? Number one, you should try for 6 months or 1 year naturally, and then you have to go for evaluation of your cause of infertility. So basically, in secondary infertility, we will go for three basic tests. Number one is the pelvic scan, that is the ultrasound of the physiological organs, uterus, ovary, and tubes. And the second thing is the semen analysis to see the any abnormal semen parameters. And third is the or laparoscopic diaper, that is to evaluation of the tubal factor. If these three factors are normal, then we consider some medical problems. So we'll go for some blood tests like thyroid, prolactin, or AMH level. After that, we will definitely get to know about the cause of secondary infertility, because through scan and through blood test, we would like know that what is the cause of secondary infertility and how to treat this. So it is not we have a basket of investigation, right? But it depends on the couple's problem and couple's history. Sometimes by getting the previous history of her first pregnancy or duration between the first and second infertility, we will somehow we will connect it with the cause of infertility.
All right. I think thank you so much, Dr. Varhsa. I think you have helped us to understand secondary infertility better in a very simple manner. I'm sure all the people who would be watching this video today with us and who will be watching it in future will understand secondary infertility much better. Thank you so much, Dr. Varhsa, for that. I think now it's time for us to invite certain questions from our audience. and we'll see if they have any specific doubt regarding this topic. If you permit, I would just like to take up certain questions that have come our way. Okay, so out of these questions, Dr. Varhsa, we have a question. So I had a previous surgery which was C-section. Can this be a factor which would come in way? I think this is what they are trying to ask. So probably the patient had a C-section earlier. She's trying to understand if that would be a factor she should be worried.
See, only previous C-section cannot be a cause of your infertility. It may be a factor which is aggravated by other factors, right? Because initially your age at that time of your previous cesarean and now at this moment of time, what is your age? What is your current menstrual cycles? And third thing which can affect by cesarean section is the only your endometrial lining. I have seen many cases where C-section has been done and after that missed abortion or any abortion has occurred and DNC has been tried, and then there is a lot of problem with her endometrial thickness. So this may be a reason that your endometrial lining, it is not that enough, that is around 7 to 9 millimeter, which is a good endometrial lining to get pregnant. So this may be a cause, but alone cesarean C-section history is not, it cannot be a cause of this.
Okay.
So I think you should go for a total evaluation of her causes. First of all, go for a ultrasound, especially on her day 14 to day 21. This is a timing for implantation. If your endometrium lining is triple layer and it is more than 7 millimeter, then definitely this could not be a cause of her infertility.
Thank you, Dr. Varhsa, and I thank for the question. Another question. Okay, so Dr. Varhsa, I guess they're trying to understand if the age is 37 years old, does any diet and lifestyle factors will help in improving egg quality?
Yes, diet moderation is the most important agenda in maintaining the egg quality. You should go for to know what is your BMI. What is BMI? BMI is a ratio of your weight and height. So if it is under your height, accordingly to your height, what is your BMI? Maintain that BMI by diet and your regular exercises. Because when you do exercise, when you do a healthy diet, then there is a less biochemical toxic products in your body which can adversely affect your egg quality. So after 35 years, take a regular antioxidant in your diet. It may be through diet, it may be through antioxidant supplements, some kind of tablets which contain the antioxidant and reduce your reactive oxygen distress factors, which can affect your egg quality. So diet modification and lifestyle change is very much important in maintaining your fertility.
Thank you, Dr. Varhsa, for answering that question. We'll take up one more question before we wrap. So there's a question. So what should be the right time to consult a specialist? Probably they're trying to understand if they're trying to conceive naturally, how long they should wait before until they're able to conceive. How long they should be trying it naturally before consulting a infertility specialist. I think that's what they're trying to ask.
Definitely, I have already explained it, that if you are age of 30 years, then try for a year. And if you are above 35 years, then try for 6 months. But again, it is individualized. Okay, if you want a pregnancy as early as possible, try for 1 or 2 months, because in 2 months there is chances of ovulation from both the ovary, right and left, and there is chances for both the tubes to help in pregnancy. If it doesn't occur, then definitely we go for evaluation of your infertility, because sometimes if your age is more and you are waiting for 6 months and 1 year, then suddenly there is decline in the egg quality. So at that time, couple should need an IVF with egg donation. So don't waste much time. If you want a second baby, then as early as possible, get that evaluation done and then take the treatment.
Thank you so much, Dr. Varhsa. I'm sure it was it will be a wonderful discussion points for everyone who would be trying to understand about secondary infertility. Thank you so much for that, and thank you everyone for joining us live today. And we hope that we were able to answer the questions. We had certain questions which Dr. Varhsa had already taken up during her discussion. So
just want to give a take-home message for the audience that if you want a second baby, ideally the age between the first and second baby should be 3 years. But nowadays, as we are seeing many cases of infertility, I think there is no certain age, can be defined as a gap in between the two babies. Because sometimes we that one baby is enough, and we are living happily with a one baby, and everything is fine. And suddenly, when the baby becomes 5 years and he demands that I need a sibling, then achanak se we thought that now I have to plan a baby, and that your age not supporting, your body not supporting, and ultimately the patient couple comes to us, and then we have to we have to give an option of IVF and sometimes with egg donation. So that is very much threatening. It kind of nightmare for the couple. One baby own eggs and own sperms, and then suddenly doctor is saying that you need egg donation. So there is no time limitation. If you want a second baby in future, then plan it as early as possible, because this time a lot of stress related to your family, related to your profession, and various factors, various pollution is there which are affecting sperms and eggs in a very damaging factor. So please try to think upon that. If you're planning a second pregnancy, try it right now.
Great. Thank you so much, Dr. Varhsa. That was wonderful. A summary of the entire discussion that we had. Thank you so much. And I would like to mention everyone who's watching us live and who will be watching this video. If you have any other questions regarding secondary infertility, please do write to us. We'll try to reach you with with an appropriate answer from Dr. Varhsa. If you're not able to ask us right now. And moving forward, if apart from this, if there is any other topic you would like us to talk on We Talk Do You, please do write to us on pubertytomenopause.com. We would be glad to bring yet another specialist who can talk to you and who can interact with you. So with this, I thank everyone for joining us today, and I wish you a very good evening. Thank you so much, Dr. Varhsa, for joining us. Thank you so much. Thank you so much, everyone. Have a very good evening.